a strategy absolutely central to my plan for change that will finally.
Egyértelmű, hogy mi lesz a fejlemény, azt majd meglátjuk. De én örülnék neki, hogyha kiderülne minden.
And on the ground, Russian forces have been pushing harder than ever.
The past week in Britain was marked by a growing sense of strain on national systems, a feeling shared by public officials and citizens alike, as communities navigated an unusual convergence of challenges. Though many of the assumptions and rumors circulating online painted a picture of sudden national collapse, the truth was far more grounded. Britain experienced a combination of service backlogs, public unrest in pockets of major cities, and a political atmosphere that felt heavier than usual. For many, the week served less as a moment of catastrophe and more as a mirror, highlighting pre-existing pressures within public services, governance, and public expectations. The sense of tension was real, but it stemmed from systemic stress rather than the extreme collapse narratives that sometimes overshadow nuanced understanding. This episode became a reminder that every democracy, even well-established ones, occasionally confronts weeks where the weight of multiple issues converges and exposes vulnerabilities that require attention, transparency, and coordination. Early signs of overload. The first indications of unusual strain appeared quietly, embedded in day-to-day operations rather than dramatic events. Several local councils reported overcrowded service centers, delays in processing administrative requests, and staffing shortages caused by illness, seasonal demands, and unresolved funding gaps. At the same time, frontline workers, from hospital reception teams to neighborhood police units, described feeling stretched by a spike in routine calls and community concerns. None of these pressures were entirely new, but their sudden overlap created a sense of acceleration. Public conversations rapidly shifted from frustration about wait times to broader worries about whether public systems could sustain rising demand. These practical disruptions, rather than any singular dramatic event, marked the start of a week that would grow increasingly difficult for officials to manage and for citizens to interpret clearly. Communities react to uncertainty. By midweek, the growing pressure on public services began to shape public behavior. Community gatherings, online forums, and neighborhood groups filled with discussions about safety, service capacity, and whether government agencies were communicating enough about the situation. In some parts of London and other major cities, small groups formed demonstrations expressing concerns about a mix of issues, ranging from housing access to public service delays. Most gatherings remained peaceful, but the speed of information online amplified fears faster than authorities could clarify what was happening. This mismatch between public concern and official communication created a sense that events were unfolding more dramatically than they were. The impression of rapid escalation stemmed not from widespread violence but from heightened public anxiety, in an age where rumors spread instantly and context often lags behind. Media coverage and the pressure of perception. National and international media outlets began covering the situation with urgency, though coverage varied dramatically in tone. Some broadcasters emphasized operational challenges within public services, focusing on concrete issues like staffing shortages, infrastructure strain, and long-term planning gaps. Others framed the developments as symptomatic of broader political or social decline. This divergence in interpretation added complexity to public understanding. For many households watching from their living rooms, the televised contrast between Britain's difficulties and the more assertive rhetoric coming from political leaders abroad contributed to feelings of frustration or confusion. The juxtaposition wasn't about factual comparisons, but about perception. How one nation's confident messaging can amplify another nation's introspective mood. In reality, Britain was navigating a difficult week, not a fundamental unraveling, but the power of narrative shaped how the moment was emotionally experienced. Inside government, a struggle to keep pace. Within government offices, the atmosphere reportedly grew tense as departments worked to compile accurate updates while managing public expectations. Internal coordination, always a complex task during busy weeks, became harder as delays in one area created bottlenecks in others. Staff members described a sense of working against the clock, organizing briefings, confirming data, and attempting to create unified messaging that avoided speculation while acknowledging challenges. Some reports suggested that senior officials, including the Prime Minister, were under significant pressure to deliver clarity quickly. Yet producing accurate, complete information during evolving situations is never simple. What appeared to the public as political silence often reflected the slow, methodical process of verifying details before speaking. This lag, though understandable from an administrative perspective, contributed to perceptions of governmental distance at a moment when the public craved reassurance. Public services under stress hospitals, local clinics, and emergency services faced heightened workloads that pushed them close to operational limits. Seasonal surges, staffing gaps, administrative backlogs, and increased calls from worried residents all converged, creating longer wait times and fatigue among frontline workers. Emergency dispatch centers reported elevated call volumes, not because of a surge in severe incidents, but because heightened public anxiety led to more precautionary calls. Paramedics and hospital staff described the week as heavy, not catastrophic. The system was not collapsing, but it was bending under cumulative strain. Many healthcare workers emphasized that these challenges reflected deeper structural issues that had built up over years, rather than a dramatic change from one week to the next. The communications gap. One of the most significant factors shaping public perception this week was the perceived absence of consistent national communication. While various departments released statements or held briefings, the lack of a single, unifying message left room for speculation. Citizens often filled informational gaps with assumptions, and online platforms amplified dramatic interpretations over measured explanations. This mismatch between factual complexity and emotional immediacy created the impression of governmental inaction. In reality, multiple departments were working intensely behind the scenes, but the public rarely saw the breadth of those efforts. The experience reaffirmed an important truth. In moments of strain, communication is not secondary to governance. It is a core responsibility that shapes citizen confidence as much as policy outcomes themselves. Comparisons with other nations. The week also sparked conversations about how other countries were handling their own challenges. Some commentators pointed to the United States, where strong rhetoric about border policy and security measures created an impression of decisive action. Others noted that while every nation faces its own pressures, comparing different political systems can oversimplify complex realities. Britain's challenges were rooted in administrative workload, long-term resource planning, and communication strategy, not in sudden systemic breakdowns or failures of national integrity. Still, the contrast in messaging between political leaders abroad and Britain's more cautious approach contributed to a sense of unease among some viewers. Ultimately, the comparisons revealed more about public emotion than about policy effectiveness. Institutional strain and internal friction. As the week progressed, internal tensions reportedly grew within government departments. Different agencies interpreted emerging data differently, leading to debates over priorities such as funding distribution, resource allocation, and short-term emergency responses. Some staff described the environment as triage-like, referring not to literal emergency room chaos, but to the need to choose which issues required immediate attention. These internal disagreements were not signs of collapse, but of the difficult balancing act that governments must perform during periods of elevated strain. When multiple systems, healthcare, local councils, policing, transport, simultaneously feel pressure, the coordination task becomes more demanding than usual. What leaked reports showcased was not institutional failure, but institutional fatigue, the kind that emerges when existing systems are asked to support more than they were originally designed to handle. A nation seeking reassurance. By the week's end, Britain found itself in a contemplative mood. Households across the country were left with mixed feelings: concern about visible strain in public services, frustration at communication delays, and a desire for clearer leadership during moments of uncertainty. Yet beneath these worries was also a sense of resilience. Communities continued to function, local organizations stepped in to support vulnerable groups, and public servants continued working through the backlog, one call, one appointment, and one request at a time. Britain was not in freefall. It was experiencing a difficult moment that illuminated long-standing needs for investment, modernization, and stronger communication strategies. For many, the week served as a reminder that national strength is not the absence of difficulty, but the ability to navigate it openly and constructively. Looking ahead. The questions that remain. As the weekend approached, the national mood shifted from fear to reflection. Analysts, community leaders, and everyday citizens began asking deeper questions. How can public services be better supported? How can communication during challenging weeks be made clearer and more unified? How can government departments work together more effectively during overlapping pressures? And most importantly, how can trust between the public and its institutions be strengthened? These questions do not point to collapse, but to an opportunity. A moment in which the country acknowledged the weight on its systems and considered how to reinforce them. The week highlighted vulnerability, but also the possibility for renewal through honest assessment and collaborative planning. Your voice matters. In times like these, public dialogue becomes essential. The experiences of everyday citizens, those who interact with local services, who rely on transport networks, who care for their families and communities, form the most accurate record of moments like this. Your perspective shapes not only public understanding but also the direction of future policy. Whether you believe the government maintained adequate control, struggled to respond effectively, or needs to rethink its approach entirely, your reflections help chart the path forward. This week marked a moment of national introspection, and the story of what it meant, its weight, its lessons, and its opportunities, will ultimately be written by the people who lived through it.